Okay, the next exercises we're going to talk about or refer to as the level 1 trunk exercises. What we're going to have Nick do is go ahead and bend both knees up. Okay, the first one, we're going to use a pillow to give him some cushion so that when he pushes together. So we're going to put the pillow between his knees, and he's going to squeeze together. This is called hip adduction. He's going to squeeze and hold. Notice that he's breathing naturally, normally, not holding his breath. We're going to go for 10 seconds. And when you do these at home, I want you to do 10 repetitions. Okay? The important thing with all of these exercises, since they are isometric exercises, isometric meaning you contract the muscle but you're not actually going anywhere, is that you want to ease in until you hold it with a nice, strong, but not uncomfortable tension. Hold for the 10 seconds, and then ease back out of it. Give yourself about 3 seconds rest in between, and then go ahead and reinitiate. Again, 10 seconds, 10 repetitions. Okay? And we'll take the pillow away. The next one we're going to do is called hip abduction. We're going to take a belt. We're going to put it around his legs. And we're going to cinch that off. I don't want it so tight that it causes the knees to come together. Very important that we maintain that good base of support. So we're looking at shoulder, hip, knee, ankle, all in a straight line. Now this time what Nick is going to do is he's going to push apart, and the belt is going to create that resistance. So go ahead and push apart. Good. Again, holding for 10 seconds. He eased into it just like we want him to do. Holds for the 10 seconds. Once he's done with the 10 seconds, he goes ahead and eases back out of it. Continuing to breathe the whole time, not holding his breath. Do one more. There you go. Okay. The next one we're going to have him do is referred to as a glute set. We're going to have him go ahead and straighten his legs out. This is a little easier to do it this way. And all we're going to have him do is we're going to have him contract his gluteus maximus. Now go ahead and do that for me, Nick. And notice how he raises up slightly, right? By changing the contour of the muscle, it changes his position on the table. So all he's doing is literally just clenching his buttocks. Holding for 10 seconds, not holding his breath. This is one of the more challenging ones to not hold your breath on. So you may want to count out loud, as we've referred to before. You want to count out loud so you don't hold your breath. Okay. And then when he relaxes, go ahead and relax. You see how he settles back down to the table. Again, holding for 10 seconds, doing 10 repetitions. Okay? The next one we're going to have him do is called an abdominal contraction, or we also sometimes refer to it as a posterior pelvic tilt. We want to avoid making the hips go way back into the table, though. We want to maintain that neutral position. So what we're going to do is, if you want to come on over here, we're going to see that he's going to tighten up and he's going to bring his ribs down. And you see how he goes to tighten up. Go ahead and relax for me. And you can see when he's relaxed, he's got nice tone, but not tense. And go ahead and tighten up. You see how he's rocked his hips just slightly, but he still has a nice arch in his back, and he's brought his rib cage down, almost like he's pulling it down towards his hip, because we know that the abdominal is attached to the bottom, or the bottom of the rib cage and the top of the pelvis, and so he's got a nice contraction. Again, not holding his breath the whole time while he's doing it. Just a nice, easy contraction. Hold for 10 seconds and doing it 10 times. The last exercise that we're going to have Nick do is something that you're not going to necessarily see him be able to do, but I'm going to describe it for you anyway. Go ahead and bend both your knees up. This is referred to as a pelvic floor contraction. The easiest way to demonstrate this for the first time, whenever you go to the bathroom and you're going to urinate, and you want to hold the stream for a couple of seconds and then relax, and hold the stream again for a couple of seconds. That muscle that aids you in stopping the flow of urine is the pelvic floor muscle, and that's the one that we want to try and activate. And the reason for that is because it is one of the best ways that we can get you to activate your transverse abdominis. So it's the muscles in your abdominal group that come down at an angle. Okay? So you're not going to see a lot of dramatic movement here, but go ahead and hold a pelvic floor exercise for me. Ready? Go. Okay, so nothing real dramatic, but you definitely can see a little activation in his transverse abdominis when he does that. Again, you're holding for 10 seconds. Don't hold your breath while you're doing these, and you're going to do 10 repetitions. And so that'll be the level 1 trunk exercises.